If your knee hurts when you stand up from a chair, or your hip starts aching halfway through a walk, it is easy to call it arthritis and move on. But that may be the mistake, because joint pain is not always a simple story of cartilage wearing away. Sometimes the real problem is the system around the joint, the fluid, the tendons, the muscles, the nerves, and the way the joint is being loaded every day. A joint is a living system. Cartilage, bone, synovial fluid, capsule, ligaments, tendons, muscle, nerves, blood flow, and daily load. So the better question is not simply what is the label. The better question is, which part of the joint system is asking for help? Because pain is not a photograph of cartilage. One person can have an X-ray that looks terrible and still walk comfortably. Another person can have only mild changes on imaging and still feel pain every morning. That tells you something important. Pain is the brain receiving information from a whole joint environment. Before we go further, one warning matters. A hot, swollen joint with fever or chills, severe pain after a fall, inability to bear weight, a joint that looks out of place, or numbness after an injury is not something to analyze calmly at home. That needs medical help quickly, because infection, fracture, dislocation, or nerve injury can damage a joint faster than ordinary wear ever could. For the quieter, repeated aches, I want to show you the hidden system. And if this kind of explanation helps you see your body more clearly, press the like button and subscribe to Feynman's Body Code. I am building this channel around the systems behind the symptoms, not quick fixes or miracle promises. Now look at a joint as a mechanical conversation. Cartilage is the smooth surface that helps bones move with low friction. Synovial fluid is the slippery fluid that lubricates and nourishes the joint. The synovium is the lining that makes and regulates that fluid. Ligaments guide the joint and keep motion within a safe path. Tendons connect muscle to bone and transmit force. Muscles absorb shock before the joint has to absorb it. Nerves monitor pressure, stretch, inflammation, and threat. Bone underneath the cartilage responds to load too. When one part becomes irritated, the whole conversation changes. This is why the phrase bone on bone can be misleading. Cartilage does not contain pain nerves the way skin does. The pain often comes from other tissues: inflamed synovium, stressed bone, stretched capsule, irritated tendons, tight muscles, or sensitized nerves. Cartilage damage matters, but it is not the only speaker in the room. The first hidden reason your joints hurt is loss of lubrication. A healthy joint is not dry machinery rubbing itself apart. It is closer to a pressure-bearing, fluid-filled surface that depends on movement. Synovial fluid spreads across the cartilage when the joint moves. Gentle motion helps circulate nutrients through cartilage, because cartilage has limited direct blood supply. That is why complete stillness often makes many joints feel worse. The joint gets quiet, then stiff, then more painful when you finally ask it to move. This is the classic startup pain. The first steps feel rough, then motion warms the system. That does not mean you should force through sharp pain. It means the right dose of movement can act like lubrication, while no movement can let the system thicken and stiffen. The second hidden reason is weak shock absorbers. Your muscles are not separate from your joints. They are part of the joint protection system. When the thigh muscles weaken, the knee takes more of the braking force. When the hip muscles weaken, the knee and lower back often start receiving sloppy loads. When the calf and foot muscles lose strength, the ankle and knee get less help with every step. This is why joint pain after 50 often arrives with muscle loss. The joint is not only wearing out, the support crew is disappearing. A knee with strong surrounding muscles and a knee with weak surrounding muscles are not the same knee, even if the cartilage picture looks similar. Strength changes how force travels. Strength changes balance. Strength changes confidence. And confidence matters because pain makes people move carefully, then less, then weaker, then more painful. That loop can become more damaging than the first ache. The third hidden reason is tendon irritation. Many people say their joint hurts when the actual angry tissue is the tendon near the joint. A tendon is not just a rope. It is living tissue that adapts to load but slowly. If you suddenly walk more, climb more stairs, carry heavier bags, or return to exercise too aggressively, the tendon may complain. Tendon pain often sits at the edge of the joint, front of the knee, side of the hip, back of the heel, outside of the elbow or shoulder with reaching. It may feel worse at the start of movement, improve as it warms, then punish you later. This is different from simple cartilage wear. The solution is usually not total rest forever. The tendon often needs load that is reduced, controlled, and progressed. Too much load irritates it. Too little load leaves it weaker. The fourth hidden reason is an irritated joint lining. The synovium can become inflamed, and when it does, the joint can swell, feel warm, and lose its normal smoothness. Swelling is not just extra water. It changes pressure inside the joint. It can inhibit nearby muscles, especially around the knee. That means a swollen knee can make the quadriceps shut down a little, which makes the joint feel less stable. This is why swelling matters even when pain is not extreme. It is a sign that the joint environment is not calm. Repeated swelling after activity tells you the dose was too high, the mechanics were poor, or the underlying condition needs attention. If swelling keeps returning, or the joint is hot, red, and you feel unwell, that deserves medical evaluation. The fifth hidden reason is bone stress beneath the cartilage. Under the cartilage is subchondral bone. That bone is alive, responsive, and sensitive to load. When cartilage thins or mechanics change, force can concentrate into smaller areas. The bone may respond by becoming denser, forming bone spurs, or sending pain signals when load exceeds tolerance. This is one reason stairs, hills, getting out of a low chair, or standing after sitting can feel so specific. Those movements do not only bend the joint, they multiply force through certain surfaces. The knee behind the kneecap, for example, can feel pain on stairs because the joint compression rises sharply. The hip can refer pain into the groin, thigh, or even toward the knee. The spine can create stiffness, joint pain, nerve symptoms, or weakness depending on what structures are involved. So location can be deceptive. The place you feel pain is not always the only place creating the problem. The sixth hidden reason is the load signal from body weight and metabolism. Extra body weight matters mechanically because every step multiplies force through the knees, hips, ankles, and feet. But weight is not only a physics problem. Fat tissue can also participate in inflammatory signaling. Poor glucose control, poor sleep, smoking, and low activity can keep the whole repair environment less favorable. That does not mean joint pain is your fault. It means the joint is connected to the rest of the body. The cartilage cell does not live in a private universe. It lives in a chemical environment shaped by movement, fuel, inflammation, hormones, sleep, and blood flow. This is why some people feel better when they improve general health, even before the joint structure has visibly changed. The joint did not become brand new. The environment around the joint became less hostile. The seventh hidden reason is nerve sensitivity. Pain is not only damage, pain is protection. When a joint has been irritated for a long time, the nervous system can become easier to trigger. A movement that is not dangerous may feel threatening. The brain may tighten muscles around the area, change your walking pattern, and make you guard the joint. That guarding can help for a day. But if it becomes the default, it changes mechanics and feeds the loop. This is why chronic joint pain often needs more than one lever. You may need strength, graded movement, better sleep, less swelling, improved load management, and time for the nervous system to trust movement again. The eighth hidden reason is loss of range. A joint that stops moving through its normal range becomes a smaller joint in practice. The capsule tightens, muscles shorten, the nervous system forgets positions it no longer visits. Then normal life starts asking for motion the joint has stopped practicing. Reaching overhead, kneeling, squatting, rotating the hip, opening a jar, or turning the neck suddenly feels like a threat. The answer is not aggressive stretching into pain. The answer is gradual exposure to safe range. Small, repeated motion tells the joint, this path still exists. Now put the system together. Joint pain after 50 is often not one villain. It is a loop. Less movement, weaker muscle, worse load distribution, more irritation, more guarding, less confidence, and more pain. Arthritis may be part of that loop, but it may not be the whole loop. That is why only blaming arthritis can make a person passive. If the word arthritis makes you think the joint is simply doomed, you stop looking for levers. But there are levers. The first lever is the right kind of movement. Painful joints usually dislike both extremes, too much sudden load and too much stillness. The useful middle is frequent, tolerable motion. Walking, cycling, water exercise, gentle mobility, or controlled range work can keep the system moving without trying to win a contest. The rule I like is pain that stays low, settles after activity, and does not create a next-day punishment is usually a better signal than pain that spikes and lingers. The second lever is strength around the joint. For knees and hips, that means quads, glutes, hamstrings, calves, and foot control. For shoulders, that means rotator cuff, shoulder blade control, and upper back strength. For hands, that can mean grip work, tendon glides, and reducing unnecessary strain. Strength training should begin below the panic line. The goal is not to prove toughness. The goal is to send a repeatable signal. This tissue is still needed. The third lever is load management. If a joint flares after every long walk, the answer may not be to quit walking. It may be to reduce distance, change surface, add rest points, improve shoes, build strength, and increase gradually. Joints like adaptation. They do not like surprise. The fourth lever is reducing the background inflammatory load. Sleep, smoking, excess alcohol, poor glucose control, ultra-processed food, and chronic inactivity can all make the repair environment worse. You do not need a perfect life to have better joints. But the joint notices repeated signals. The fifth lever is knowing when to get measured. If pain keeps returning, stops normal activity, affects sleep, lasts more than a couple of weeks despite sensible care, or morning stiffness lasts more than 30 minutes, it is worth getting evaluated. Evaluation might include a physical exam, strength and range testing, imaging when appropriate, blood tests, if inflammatory arthritis is suspected, or referral to physiotherapy. The point is not to collect labels. The point is to identify which part of the system is actually failing. There is also a useful difference between mechanical pain and inflammatory pain. Mechanical pain often complains when the joint is loaded. It may show up on stairs, during squats, after long walking, when gripping, or when standing from a chair. It often improves with rest, then returns when the same load returns. Inflammatory pain can behave differently. It may be worse after rest, worse in the morning associated with warmth or swelling, and take longer to loosen. Long morning stiffness is a clue, because the immune system and joint lining may be part of the story. That does not mean you can diagnose the cause from stiffness alone, but it gives you a better question to ask. Is this mainly a load problem, a swelling problem, a tendon problem, a range problem, or a body-wide inflammatory problem? Each one points to a different lever. This is why copying someone else's exercise routine can fail. Their knee pain may be a weak muscle problem. Your knee pain may be a tendon dose problem. Another person's hip pain may be referred from the spine. Another person's hand pain may be inflammatory. The same word, joint pain, can hide different mechanisms. The goal is to stop treating every ache like the same ache. Here's the simple way I would think about it. If pain is sharp, sudden, traumatic, hot, red, associated with fever, or you cannot bear weight, do not play detective. Get help. If pain is repeated but not dangerous, start mapping it. Which joint hurts? What movement triggers it? How long morning stiffness lasts? Whether it warms up or worsens with use? Whether swelling appears? Whether strength is disappearing? Whether sleep, weight, stress, or activity changed before the pain changed? That map is more useful than saying, my joints are bad. Bad is vague. A pattern can be acted on. The practical first month is simple. Do not completely stop moving the joint. Choose one tolerable daily movement. Choose 2 strength exercises that support the painful area. Reduce the one activity that reliably flares it beyond recovery. Improve one background signal. Sleep, smoking, alcohol, glucose, or body weight. Track pain, stiffness, swelling, and function for 4 weeks. If the trend improves, you found a lever. If the trend worsens or the pattern looks suspicious, get measured. That is the real reason your joints hurt. Not always because the joint is simply old. Not always because cartilage is gone. Often because the joint system is losing lubrication, support, tolerance, range, or a calm chemical environment. Your joints are warning you before they wear out. The warning is not a sentence. It is a request for better signals, better loading, and better attention.